CNA Occupied Bed Procedure Explanation. Welcome to the quiz. Question 1. A resident who has had a hip replacement is being log-rolled for linen change. You notice the surgical incision is slightly red, warm, and has a small amount of foul-smelling drainage. What is your priority action? Option A. Complete the linen change quickly to minimize resident discomfort, then report the condition of the incision to the nurse immediately. Option B. Remove the dressing, clean the incision with sterile saline, and apply a new sterile dressing. Option C. Note the findings in your charting and continue with the linen change, covering the resident back up. Option D. Tell the resident that the incision looks like it's healing nicely and not to worry. The answer is A. Finish the task safely, then report signs of infection urgently. Option A is correct because you need to finish the task safely, then report urgently. Option B is incorrect because CNAs do not change dressings. Option C is incorrect because documenting alone is not enough, reporting is needed. Option D is incorrect because it dismisses signs of infection. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed. No fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 2. A resident on oxygen therapy via nasal cannula complains of dryness in their nose and on their cheeks where the tubing rests. What is an appropriate nursing assistant intervention? Option A. Apply a water-based lubricant to the nares and a small piece of gauze or a commercial pad to the cheeks under the tubing, as per facility policy, to soothe dryness and prevent skin breakdown. Option B. Remove the cannula for an hour to give the nose a break from the drying effect. Option C. Use an oil-based lubricant like petroleum jelly to soothe the dryness and protect the skin. Option D. Increase the oxygen flow rate slightly, as higher flow adds more moisture. The answer is A. Water-based lubricant soothes dryness and protects skin. Oil-based can degrade tubing. Option A is correct because it soothes dryness and protects skin. Option B is incorrect because removing oxygen is unsafe. Option C is incorrect because oil-based can degrade oxygen tubing. Option D is incorrect because increasing flow doesn't add moisture. Question 3. You are providing a bedpan to a resident who has strict mobility restrictions. After the resident has a bowel movement, what is the proper technique for removing the bedpan? Option A. Roll the resident to one side away from you, holding the bedpan steady, remove it, and then roll them back to clean the area. This prevents spillage and is safe for the resident. Option B. Tilt the bedpan to one side to empty any liquid contents into a container before removing it from under the resident. Option C. Pull the bedpan straight out from under the resident from the front. Option D. Ask the resident to lift their hips using the trapeze so you can slide the bedpan out. The answer is A. Rolling the resident to one side prevents spillage and is safe. Option A is correct because it prevents spillage and is safe. Option B is incorrect because tilting under resident is awkward. Option C is incorrect because pulling straight can cause spillage. Option D is incorrect if resident cannot lift. Question 4. When making an occupied bed, what is the primary reason for keeping the side rail up on the opposite side of the bed? Option A. To ensure the resident's safety and prevent them from accidentally rolling off the bed while you are working and the mattress is moving. Option B. To make it easier to tuck in the fitted sheet on the far side. Option C. It is facility policy, regardless of the resident's mobility or cognition. Option D. To provide a convenient place to stack the clean linens while you work. The answer is A. Safety is the primary reason for keeping the far side rail up. Option A is correct because safety is the primary reason. Option B is not primary. Option C is not accurate. Option D is not primary. Question 5. A resident with a fractured hip is in Bucks traction. When providing morning care, you should: Option A. Maintain traction at all times by not removing the weights and working carefully within the limits of the traction setup. Do not lift or remove the weights. Option B. Remove the traction weights to wash the leg more easily. Option C. Increase the weight slightly temporarily to ensure good traction while you work. Option D. Ask the resident to hold the weights up while you change the linens underneath. The answer is A. Traction must be maintained continuously. Option A is correct because traction must be maintained continuously. Option B is incorrect because removing weights disrupts traction. Option C is incorrect because altering weight is unsafe. Option D is incorrect because resident cannot hold weights. Question 6. A resident has a colostomy and you are assisting with a pouch change. You notice the stoma is a deep red color and slightly moist. What should you do? Option A. Clean the area gently and apply the new pouch. As this is a normal, healthy appearance for a stoma, it should be red and moist, like the inside of the mouth. Option B. Cover the stoma with a dry gauze dressing instead of a pouch to let it air out. Option C. Report this finding to the nurse immediately as it indicates a serious problem like infection. Option D. Tell the resident that the stoma looks infected and they need to see the doctor. The answer is A. A healthy stoma is red and moist. Option A is correct because a healthy stoma is red and moist. Option B is incorrect because covering with gauze is not appropriate. Option C is incorrect because that is normal. Option D is incorrect because alarming the resident is wrong. Great job! Don't forget to subscribe. Bye!